Preventing hand and wrist injuries. The first one is de Quervain's tenosynovitis, which is an overuse injury. This injury is identified as swelling and inflammation of the extensor tendons on the thumb side and can affect both extensor pollicis brevis and abductor pollicis longus. This injury can affect flexion and extension of the wrist. It is most common in sports such as rowing and gymnastics due to the repetitive wrist bending. Next, we have extensor capri ulnaris injuries, also known as ECU. These injuries are inflammation of the ECU tendon and can be caused by repetitive microtrauma. Treatment includes splints, braces or plaster casts, rest, and finally surgery. Finally, we have skier's thumb, which is a tear in the ulnar collateral ligament in the thumb joint causing instability, and it also is caused by hyperextension and abduction of the thumb, especially in sports such as basketball, rugby, skiing.
Let's go to the volleyball court. The first causes that cause right and hand injury is wrong technique, which can be shown here. If we use a wrong technique to receive the ball, will cause right and hand injury occur. The second causes were caused by the repetitive raise movement, which shown in the photo. The next causes is because of the direct trauma occurs.
Prevention and risk injury before and after play a sport involve a proper technique, proper preparation and a recovery proactive. Here are some tips to prevent the injuries. The first one is we need to warm up. So warm up is very important. So warm up can increase the blood flow and flexibility. So the second one is strengthening exercise. So strengthening exercise, for example, we can use stretch ball or resistant band to exercise the muscles of the wrist and hands. So the third one is use a proper gear. Proper gear like hand brace or wrist brace to support the muscles. So the third one is practice a good technique to avoid more strains on the hand and wrist. So the last one is stay hydration and nutrition. So to keep the muscle and tendons healthy always. That's all from me. Thank you.
Okay, so after exercise, the first prevention is cooling down. Cooling down can to prevent the tension and also the prevent stiffness. The second prevention after exercise is ice therapy. So ice therapy can make us feel comfortable and also control our inflammation. The third prevention after exercise is rest. So rest can allow our hands and also legs to release the pain and also feel comfortable after exercise. So the fourth prevention after exercise is monitor pain. So we have to control our torrent and also swelling immediately after exercise. Fifth prevention after exercise is stretching. So stretching will help us to stay our flexibility after exercise. So biasa kan korang striker kan injek kat mana?
Striker dia akan injek kat belah shoulder sebab banyak guna force kat shoulder lah.
Oh, so tu punya tangan biasa guna tangan right hand lah.
Ya, right hand.
Apa lagi? Oh, kalau waist kan dia tak biasa injek.
Waist dia depends. Kadang-kadang kalau salah teknik dia akan injek lah.
Boleh tak bagi tahu macam teknik tu salah?
Kalau dia macam kadang-kadang bola macam ni kita Dia tak tepat lah. Dia kadang-kadang dia akan
Okay. So masa tu lah West. Kalau West injured kan, apa yang kau buat? Apa yang kau buat selepas kau injured? Recovery tu lah.
Kita recovery lah dalam 2 minggu macam tu. Kita akan buat rehab.
Lihat. So yang tu aku nampak ada seorang yang pakai lagi.
Ya.
So
Tape tu.
yang tape tu kau biasa pakai.
Lepas tu kita kalau pakai untuk kalau ada tournament besar lah untuk prevent injury dekat bahagian tu.
So kalau dah injured tu pun pakai juga.
Kalau injured mah pakai juga. Dia depends on orang.